Welcome back to Conversations with Boston School Psychologists, building safe and supportive schools one conversation at a time. This is the podcast where we highlight the people, practices, and partnerships shaping behavioral health and school psychology across Boston public schools. I'm here today with Dr. Achilles Bardos and Dr. Carolyn Hall. Thank you both so much for joining us today. And so I'm going to start off with a quick introduction for each of you, and then we'll get into the questions. So, Dr. Achilles Bardos is the CEO and founding member of Edumetrisis, LLC, and a leading expert in psychoeducational assessment. He co-developed the widely used tool known as the Behavior Intervention Monitoring Assessment System, the BIMAS, which is now in its second edition, and used nationwide for screening and monitoring student behavior and social-emotional learning. A former professor and researcher, Dr. Bardos has published extensively and presented more than 300 papers and workshops worldwide. Wow, thank you so much for being here, Dr. Bardos. And Dr. Carolyn Hall is a program director here in the Boston Public Schools. And so she oversees district-wide implementation of multi-tiered behavioral health supports, professional development, and supervision of school psychologists. Carolyn also co-leads the BHS research team, bridging research and practice to strengthen the impact of school psychologists. Previously, she served as a school psychologist in both schools and at the district role, and she holds a PhD in school psychology from UMass Amherst. Thank you so much, Dr. Hall. And so, Achilles and Carolyn, let's get started. We're going to start with a question for Achilles. Can you tell us a little bit more about the idea behind the BIMAS-2? How did you develop it?
Okay. Well, thank you. Thank you, Tim. You are asking me now to summarize close to 30 plus years of history. All of it started back as me being a young professor at Alfred University in New York, where I had a very good colleague and mentor, Steve Truscott. Steve had numerous years of experience as a school psychologist. I was fresh out of college with lots of assessment background, trained by Naglieri, what I thought was like I was trained by the gurus in assessment. And we had numerous conversations about the state of mental health, psychological assessment, and so forth.
Achilles, Jack Naglieri was a big inspiration?
Yeah, Jack Naglieri. He was at Ohio State at that point.
I didn't know you guys knew each other way back when. That's awesome.
Oh, yes. I was his graduate student, his doctoral student.
Wow.
So,
what a coincidence.
So
cool.
We go back quite some time. So with Steve, we had all of these discussions about assessment, behavioral assessment, and cognitive assessment, and so forth. And I expressed to him my interest, actually, in integrating whatever technology was known at that time in the practice of school psychology. And it was the very, very early stages. Now, think about 88, 90. The web didn't even exist. Then I left and I went to the University of Northern Colorado, and all of a sudden the WWW became a part of our life. And I saw how it was implemented in the business world, so I thought maybe there is an application of this kind of technology to assessment. And continuing again with my relationship with Steve Truscott back in Alfred University, Steve one day says to me, "You need to meet this guy that I went to school with," and that was Jim McDougall. So that's the senior author, we call him for the test. And he says to me, "I think Jim is a director of psych services at Syracuse Public Schools, and he has some interesting needs that relate to assessment." So I connect with James McDougall, and we started talking about behavioral assessment, and his primary concern practicing as a director was what really works in psychotherapy and what works with interventions. How do we know that the interventions are effective? She says to me, what are you interested in? And I said, I'm interested in how I can actually take technology and put it in practice for school psychology. And I said to him, it has to be something more than Microsoft Office, because I was teaching one of the first courses at that point in technology and school psychology. We're doing pretty much email and word processing and these kinds of things. This is now early 90s. And
Right.
then we start talking with each other and we said, okay, we have this kind of needs, but do we have the content of what we need to ask? And as we were looking at each other, we said, well, we have subjective opinions, but we don't really have any research to back them up. And that's when Steve again, Truscott, connect us with another colleague of his at the University of Buffalo, Scott Meyer. And we look into the work of Scott Meyer, Dr. Meyer, and his work was only on outcome assessment in psychotherapy. So we said, link, that was it. That was the link now that brought the three of us from three different backgrounds in actually addressing what works in psychotherapy. Can we measure it effectively? And that's when Scott's work on change-sensitive items became the foundation of the BIMAS. We did some of the initial work at that point, and we saw that the test actually, the pool of items we had was sensitive enough to detect the changes that we were talking about with some clinical groups. Then around 2000, 2001 or whatever, RTI comes in place. And everybody was talking about screening for academics. 2 years later, in the 2003 report by the Commission, the report was encouraging people to look into the behavioral also. And we found out that behavior and academics were actually in alignment. And then we said, how about if we do some studies to see really if the BIMAS and the questions that we used for progress monitoring interventions are sensitive enough to actually be used as screeners. And that's when we were having these pleasant findings that indeed these questions were really sensitive to detect those kids who were the kids that we were trying to measure the effectiveness of intervention were the kids that the BIMAS actually was able to identify to be in those interventions. And at that point, and here is where the challenge became for the three of us. We went out and we started looking for publishers to the idea of prevention. These kids in special education are coming from somewhere. And we were saying they're coming from regular education. Something is not going in the direction we all wish to go, and they end up with some behavioral issues for whatever reasons, and here they are now in special education. What makes them be there? Well, we kind of knew, we kind of didn't know, and then we said, let's do the screening so we can find out who these kids might be. Right at that point, we found a publisher. Once we got turned down by every single major publisher in the United States because we're talking about prevention. Prevention simply doesn't sell unless you have your heart as a customer into the concept of preventing something instead of always fixing something. And we found a publisher, Multi-Health Systems, who helped us actually develop the first edition of the BIMAS with what I consider state-of-the-art of psychometrics in terms of development, with norms, with validity studies, reliability studies, you name it. And then the question became technology. How do you take now this concept and integrate it with technology so they can be used? Because with screening, you screen lots of kids. It's not just that you take Johnny in your classroom and you give him a WISC or a KTA or a WIAD or whatever. We're talking about going to public schools and screening 50, 60,000 students and so forth. So technology had to be a significant part of it. Of course, technology at that point was in the very early stages of development. We were learning with the trial and error things. So the first edition has its bumps, major bumps in terms of implementation in the public schools. But at some point, I said to MHS, you know what? I think I want to take this over as an individual, and they were kind enough to give me the right to proceed with the version 2. Now, between version 1 and version 2, of course, we had some school districts who were willing to take that risk or put what I call their hearts and data in action, because you really need to have data, not just your heart, to sell the idea of a need for something like prevention and screening. And we didn't know anything about Boston. We didn't even know who were the clients or who were the people. We were just the authors in our positions. And all of a sudden, here comes Andrea, Mary Cohen, Jill, and this whole group of individuals saying, hey, we're using your instrument. And that's where I'm going to stop, because Carolyn can give you the story of what happens. And then I'll go a little bit afterwards, because there is a follow-up in that little window.
Carolyn, do you want to continue that story then? Go ahead.
Yeah, sounds good. And I think it's important to note that a lot of this work started before I got here. So many of this has been passed down from mentors that are here in Boston Public Schools Behavioral Health Services. And I'm excited to sort of take this on and continue the work that has been done by people long before me. But I think it is important to kind of bring things back to, so you left off around 2003 or so with your story. Fast forward to about 2010, the National Association of School Psychologists rolled out their first practice model. And there was a group of school psychologists that happened to be at that national convention. And they came back to here in Boston Public Schools and talked about, hey, there's this new way of doing the practice of school psychology. What would it take to bring that here in Boston? So we're really proud to be one of the first urban districts to practice school psychology in that expanded role, focusing on prevention and tiered supports. However, what we needed was a tool that would be able to identify the students with the greatest needs to be able to mobilize supports in an equitable way. So around that time, there was a group of us, a group of mental health providers in the school psychology department that created the comprehensive behavioral health model. But what they did was they really did some focus groups and talked to teachers, school leaders, and partners. And what they were hearing is that behavior and mental health were at the top of their priority list. And they knew that the traditional approaches of identifying kids in need of supports, they were not sufficient, and they left the door open for things like bias. So we really wanted to be a little bit more strategic when we were thinking about mobilizing multi-tiered systems of support for supporting students' behavior. And at that time, we also started to strengthen our university partnership. So there was a group of people, particularly at this time, folks from Children's Hospital and UMass Boston, that helped us to understand the need for a screener and helped us to develop a pilot program here in Boston of that comprehensive behavioral health model that was really rolled out over the next decade plus years. And where the screening tool comes in is to all those things that Achilles just mentioned. We were looking for a tool that was well studied. It had been studied with a diverse population of students. Here in Boston, we have culturally and linguistically diverse student body. And we also wanted something that would be able to be change sensitive so that we could use it both to monitor student progress, but also progress on the school level. And one of the things that's made it really valuable over time is our ability to monitor progress on a district level for things like program evaluation.
That's awesome. And I will also just want to add to that is during that time, very few school districts were using a universal behavior screener, right, Carolyn? Only about 5% of school districts nationwide.
Yeah. So early on in the studies of universal screening, it was such a small number of schools that were doing universal behavioral health screening. And when we think about universal by definition, it's an access point or sort of a wellness check. So just like, when kids are young and they go to the doctor and they get screened for vision or hearing, it's kind of that approach of that temperature check for social emotional behavior. So we're getting a checkpoint of every kid. So I think we'll get into this a little bit, but from the grade level perspective, it's teacher reports of student behavior. And then as kids get older, it's the student self-report. So at the age of 12 and older, we're able to directly ask kids and check in with them. And they do a self-report of how they're doing. But back to your question around the limited, when we think about universal screening, there are a lot of things that need to be in place in order to mobilize. But we felt strongly that this was going to be a key component for us to building a strong multi-tiered systems of support. So we really have dove into creating strong systems to scale screening. So I think part of it is starting small. So here in Boston, it was a pilot program. We started with 10 schools, and then over the years, we would add 10 more schools each year. And in a district of 100 plus schools, that was how we were able to mobilize something like this.
Absolutely. And Achilles, do you want to take the story now to today with all of the different features?
I want to take the story to the next level, because I can tell you, how much I have learned from Boston. And anecdotally, I mentioned once to Andrea and Mary Cohen that if I were to do my practicum in school psychology again, I would move to Boston Public Schools so I can see kind of how do you actually do school psychology from this theoretical framework, from this perspective. And as we were having all of these conversations, Jill Snyder, one of the psychologists in the team, said to me, "Are you also aware of a group called the Castle Organization?" And I said, "Of course I'm aware, but they're so different from what we do." And then she said to me, "No, they're not. Actually, we are doing with the BIMAS a better representation of the Castle foundation and framework than anyone else out there." And I said to her, "Tell me more about it." And then she says to me, "The behaviors are a reflection of those social emotional skills. So we shouldn't be talking just about internalizing, externalizing behaviors, which have been kind of the foundation in psychology for 100 years. There is value into this concept of social emotional skills, but we're going to use the BIMAS data to actually see if we can operationalize these constructs." So I work with the Boston team and with Jill being the driving force in there, and we looked at every single item, every single behavior, looked into interventions and so forth, and we bridged the BIMAS items into the Castle framework. And we were able at that point, because of the work of Jill, which is Boston Public Schools, again, the influence and the team, to create what we called a dual view of the behavior. We looked at for psychologists, we looked into the standard view, where we were saying internalizing, externalizing, you got your master's, your EDS, your PhD, you have the knowledge of how intervening with this. And then we take some of this work into the classroom, and we invite classroom teachers to participate in the delivery of social emotional skills curricula. And we said, where is the voice? Where is the data for them other than their heart? Where is the data for them to actually practice what the curriculum might be suggesting and so forth, and see the impact? So we were some of the, with the team again, I don't want to take credit for it. I just did the technology part. The credit goes to Jill Snyder and the team in Boston Public Schools, and we created this dual view approach, which parenthetically is now been followed by many others who are introducing the dual view in their assessment instruments. So that's kind of where things have evolved with a history which now closes to 30 such years of work with BIMAS.
Wow.
Amazing.
And one other thing while you were talking, Achilles, that I started to think about that is really unique to the BIMAS is that a lot of screeners come from that deficit basis, right? Identifying kids that have weaknesses in these areas. The other thing that I think is really unique to the BIMAS-2 is those two adaptive. So you're able to sort of identify the other perspective of things. So those academic skills as well as the adaptive skills to kind of capture areas where kids may have strengths as well. I think that also makes it a very well-rounded tool. What was your idea?
Yeah, thank you, Carolyn, for making that point, because we hear quite often from others who are saying, well, that's a mental illness instrument. And I said, no, it's a behavioral health instrument that includes strengths and weaknesses. And ultimately, what I always ask people when they say, we're going to do screening, the question I always say, why? What are you expecting to get out of this screening? What is the purpose? Why are you doing the screening? And naturally, you will find out the answers are both find out who are the kids who are doing fine. All the kids. That's the whole key there. And who are the ones who might be needing some support. And sometimes adaptive skills might be the ones that, although we call them the strengths, there might be weak areas. Anyway, so that's kind of where we were.
I want to segue this conversation because that's a great segue into what do we do with the data once the students are screened. So let's say we've identified the students who are at risk, and I'm going to bring this over to you, Carolyn. How does the Boston Public Schools now take this data and put it into action?
Yeah, so I think that the data is being used primarily I like to think about it on 3 different levels. So when we think about, we're able to use the screening data to identify students that may be in need of support. So that could be identifying kids for small groups. It could be to support our student success team or student support team processes on the school level. So it's used on the student level, it's used on the school level, as well as the district level. So on the school level, we train our school psychologists to be a part of what's called data review team meetings or grade level team meetings. Here in Boston, we developed a protocol called Grow the Green, where we think about, okay, how many kids at the building level were identified at risk, and what would it take for us to reduce that percentage of kids to ultimately have more students that are in the green as opposed to in the yellow or red. We try to wrap this into building level school climate conversations to think about, if we're seeing these trends, are we able to highlight a specific grade that may be lower than expected, maybe a classroom that might be lower than expected? So in addition to thinking about supporting students, maybe it's supporting groups of students, or maybe it's identifying a group of staff that this staff members, tends to really over-identify a lot of kids. Maybe they need a little bit of extra support as well. And then finally, this is a lot of where I come in. It's on the district level. So we are very fortunate to have over 10 plus years of BIMAS data that's been available to us that we can now use it as a part of our program evaluation and even research specific questions. And having all that data, we can kind of go back and analyze it for specific areas. So I think in terms of monitoring progress of how we're doing over time, and it's sort of like that indicator of how well is CBHM working here in Boston over time. And finally, I think about from a staffing or professional development perspective, we think about staff here in Boston similar to the way that we think about students. So there are some trainings that all of our staff get to support the BIMAS implementation. For newer staff, they may need a little bit more intensive supports for what does it really look like to mobilize BIMAS screening from start to finish on the school level. So what do we need to do in terms of getting a protocol in place? Who are the mental health people in our school that can help with screening as well as student follow-up? Another thing that's very unique to the BIMAS is there is critical item 24 that's become a part of a lot of our conversations, and it's a really meaningful data point. It talks about students that have reported thoughts related to self-injurious behavior. So every time a student endorses that at 1:00 on the dot here in the Eastern Standard Time, emails go out to the mental health professionals and school leaders so that we can kind of mobilize within that next 24 hours how we're going to follow up with those students and make sure that, there is an appropriate protocol and follow-up in place. So thinking really about, staff training from start to finish throughout that whole process.
That's fantastic. And I'm so glad that those important high-level items are on there as well for those who are having self-injurious behaviors or suicidal ideation, things like that. That's so critical. I want to go from the actionable steps you're taking now to the impact. And I'll leave the question open-ended to either of you. Do you want to talk about the impact it has had either in the Boston Public Schools or at the national level? Achilles, if you want, you can chime in with the impact it's having at the national level.
Yeah. Well, I had over the 20 such years now, especially after it was published. I had the opportunity to interact through webinars, face-to-face presentations, workshops, and so forth with hundreds and hundreds of school psychologists, social workers, other behavioral specialists in the schools. And the stories that you hear of the difference that it makes to have this information to address student behavior is just cannot be described with a research article or a publication. I've been in a state where a school psychologist, or actually was a social worker, broke down in tears. And she says, I don't know who you are or who your colleagues are or who has driven this kind of a work, but you made a difference in my building. And I go like, okay, that's the best publication I ever had. No references anywhere, but that was the best work. Then I had another school psychologist down here in Colorado, and I was a little aware of her work because she was an ex-student of mine of 20 years ago, and she was implementing the universal screener. And all of a sudden, I have a newspaper that publishes an article that says, it's okay not to be okay, how a universal screener saved the lives of kids in this district. 2 years later, another publication this spring in the Ed Week, a universal screener saved the lives of 6 kids in this district. And I said that was worth 25 years of work. And I said, it was very personalized. Sometimes it made me almost break down in tears, knowing that, we, with our effort and with we were just a little block in everybody's efforts to make a difference in a school system. And it was so good to be part of that overall approach, all of this initiative for mental health for the kids. So that's the kinds of things that I am proud not only of our team in here, but also proud of all the people who actually take this data and make a difference every day in the kids' lives across the country and sometimes even outside of the U.S. So
that's wonderful. That's amazing. And Carolyn, do you want to add to that as far as the Boston Public Schools impact?
Yeah, those are, tough stories to follow, but I think that here, in Boston Public Schools, we can name, similar stories. It's hard to even just think of one, right? Because there are so many over time that kind of start to blend together. But one thing that that comes to mind for me is if we can sort of be a small part of breaking the stigma around talking about self-harm or suicidal ideation, because what the research shows is that talking about suicide doesn't necessarily lead to increased risk related to it. It actually is the opposite. We want to normalize having these hard conversations. It's okay to not be okay. It's okay to ask for help. Be able to identify who in the building is a safe person to go to if I'm having a difficult time. So for me, it's in some instances hopeful because it identifies there are supports in place, and we want to have as many students as possible to have access to those supports.
Absolutely.
And the other thing here, Tim, was this kind of a work with universal screeners, the BIMAS, and many others who are out there, good other instruments who do the similar kind of work, is that has shifted our role in school psychology, because I'm a school psychologist, I say that one, but also for school counselors and others, has shifted us from primarily having the tertiary intervention as our primary role to be thinking about us functioning in a big system, in a school where we are available and we do something for all kids. So as an impact, I think that's probably the best thing I can think of for universal screeners when they are put in place in an organization like a public school or other facilities. So.
Absolutely. And kudos to you, Achilles, for creating such an amazing tool, as it has clearly saved the lives of many and improved the lives of many. So fantastic. That must be such a rewarding experience, hearing all those stories But I want to wrap up with one of these last questions, of course, bringing it back to school psychologists. And we know that school psychologists in the Boston Public Schools are leading the way in implementing the BIMAS-2. And so, Carolyn, do you want to talk a little bit more about how school psychologists are going about training and implementing the BIMAS-2 in their schools?
Sure. So one of my primary roles is to support the training and implementation of the BIMAS-2 district-wide. So, like we touched on a little bit earlier, that looks like a lot of different things for different staff at different points in their careers, because some of our school psychologists have been around since we started BIMAS here in the district, and others are new to BIMAS in the district. So it's sort of meeting staff where they're at, but also reminders are always helpful in staying up with the updates as well. But what that looks like is we encourage, now we're really proud that the BIMAS-2 is available to all BPS schools, regardless of if they're a CBHM school or not. So it's available to all, but it's really an opportunity for our school psychologists to take on a leadership role at the school level. We encourage them, if they're not doing BIMAS, to have those conversations with their school leaders and say, here's what we can offer. Here's what our training supports us in doing. We have the support of our department. How can we get started? And sometimes, it's starting small. So let's pilot it with a specific grade with the goal of then hopefully getting to all the grades in the school. But we have different protocols in place. So, next week I'll be hosting a couple of, BIMAS 101 overview sessions, and those are open to anyone in our department. We encourage them, if they want to invite someone from their school team, whether that be a social worker or school leader, they can come to that. We hold Q&A sessions. We also have, more intensive sessions for newer folks that need a little bit more training. So there's a variety of supports in place, and we are continuing to develop and improve our protocols for how to support schools so that we can continue to expand our reach in terms of how many students are screened each year. I think our highest implementation year was just before COVID, and we're slowly getting back to pre-COVID numbers.
That's wonderful. So I want to provide some opportunity for some last and final comments. Achilles, do you have anything that we missed that you wanted to share about the BIMAS-2 and the impact it's had?
To be honest with you, I think we're moving in the right direction in the area, despite financial challenges that we're facing. Ups and downs in terms of funding and so forth. I think people's hearts are still there, thinking about all the kids, and the good thing is that. Not many people from my experience, have abandoned the concept of universal screening because of budget cuts that we're experiencing right now across the country. But other than that, I'm happy that our role as mental health professionals has expanded to now think about all the kids, and through that, support the ones who are doing well, and support even twice as much the ones who need our help. So,
absolutely. So, Carolyn, do you have any final last thoughts that you want to add for the podcast as well?
Yeah, I guess I would just like to end with highlighting how unique it has been to have the opportunity to have this long-standing collaborative relationship with the publisher of the BIMAS-2. I think that we're really lucky here in Boston Public Schools. Achilles actually comes to our monthly behavioral health services research team meetings, and that's really opened the door to some fun projects. We just got approved to do an upcoming project this coming year, and we'll have a little preview of that at the upcoming Advancing School Mental Health Conference in Orlando, Florida in December, where we will be talking about implementing student screening systems at scale, lesson learned, and future opportunities. So more to come, but thank you so much. This was so fun.
And thank you both for joining. This was just such a wonderful gift to have you both on.
Thank you both too.
Thank you.
Take care.
Thank you for listening to Conversations with Boston School Psychologists, building safe and supportive schools one conversation at a time. Please follow us on our socials, Boston School Psychs, and visit our website, bostonschoolpsychs.com, to learn more about our work. Join our next conversation to learn more about resources and tips for creating safe and supportive schools. Thanks so much.